Hello, everybody. Welcome back to another interesting episode on the podcast. And with me in studio today is a Nigerian dental health professional with a very diverse background in clinical practice, public health, and a little bit of financial services. She's currently working as a public health specialist in oral health at Swindon Borough Council, NHS England. And she's by name Dr. Amblessed. Thanks so much for joining us in the studio today. How are you doing?
I'm fine, thank you, Dr. Ann. I'm doing well. I'm happy the sun is out. Everywhere is looking better and less depressing. So that's good.
It's good to have you today. I mean, for those of you who are watching around, if you're doing stuff around the public health space, you're doing MPH, you're thinking of what next, I think you might just want to stick around to the end of this video because we'll be covering all of those things, right? So I usually like starting from the beginning. So what inspired you to look at a career in dentistry?
Thank you for that question, Dr. On. I'm going to be as honest as possible.
Yep.
There was no divine inspiration to do
Okay.
dentistry. I was planning to study abroad when I was much younger. I
Mhm.
had done everything, written my SATs, gotten a pre-med admission in the US, and I had done all the steps and everything. And it was now to do like my visa and all of that. And my dad decided to change his mind last minute and say,
Wow.
you're no longer traveling abroad. You have to find something to do in Nigeria. So horrible time for me as a young lady. I obviously started scrambling what to do. I had done well in JAMB, but I didn't use the JAMB. So it was like, okay, what next? What's left?
Yeah.
What's available to be done? So long and short, I finally found myself in like after writing some of the UI entrance exams and all of that, I didn't even find my name in any of the lists that I had written. Like medicine was my first choice, dentistry
Yeah.
was my second choice. And finally, my name then came out in dentistry
Mhm.
because they said they were looking for something went missing. So when my name finally came out in dentistry, I was like, okay, I'm just taking this as God and I'm moving on. I can't fight anymore. It is a very long story, but at the end
Yeah.
of the day, I entered into dentistry. And now that I look back, I can actually say that it was God that put me in dentistry. First of all, I feel like dentistry is like the better paid, well rested version of medicine because everything that I've learned, everything that I did in school and all of that, I started to pick up that passion for dentistry very quickly. It was because it felt like I was doing everything I still wanted to do because the way we were taught in the University of Ibadan, you still do medicine till you write all the MBs till
Yeah.
yeah, I think till 500 level thereabout. Then in 500 level, you then enter and start doing core dentistry. So we had done everything. I did all my medicine modules, surgery, pediatrics, everything as it should be done. And then I went in to take that extra layer of knowledge in dentistry for 500 level and 600 level and then finished. So that's really how I entered into the dentistry space. But like I said, I came to love it and I don't think I would ever choose anything else really right now. No, seriously, when I look back, I don't think I'll ever choose anything else. So that's how I became a dentist.
So, was there any reason why your dad changed his mind at last minute?
Yes, he suddenly, apparently, he was on board with everything because he was the one actually driving me around, taking me from one place to the other, doing all the everything, paying for everything. Obviously, I didn't pay for
Mhm.
anything by myself then. He did everything, but he had a conversation with my auntie in
Okay.
Ibadan, apparently. And during that conversation, maybe she was like, oh, she's such a young girl. Do you want her to travel abroad and go and spoil? Is that what you want for your daughter? All those type of things. And he obviously swallowed it hook, line, and sinker and came to tell me, oh, Ambi, you are at such an impressionable age. I don't want you to go somewhere where I will not be seeing you. This is funny because we lived in Abia State then and I schooled in University of Ibadan. When I was in Ibadan, he wasn't seeing me for, for months plus years on end. And you know how it is with strikes and different things. You never know
Yeah.
whether you should leave school or not leave school.
Or
So
not?
at the
Yeah.
end of the day, I think I ended up we did school because I was in Ibadan when we did that 6 months ASU strike one time. So we finally eventually finished by 7 years after.
Yeah.
So you weren't seeing me as much as possible. Why didn't I spoil in Ibadan? But anyway, moving on. But that's why he made that choice. I
Decision.
found out much later that that was actually what he had wanted per se. Like someone had spoken to him, and it
Mhm.
was my aunt in Ibadan.
So looking at your career as a, let's say, dental officer back then before this space, so what were the most fulfilling and challenging parts of your work?
So you mean like the challenges I had
Yeah,
as
working as
a
a
dentist?
dental officer, yep, or dentist.
Okay. So I think the first thing before I did house job,
Mhm.
I the in UK it's called foundation year, or back in Nigeria it's called the house job for both medical and dental professionals. Before I did my house job, I think one of the first challenges I had was getting a place to do the house job, because dentistry, if you look at dentistry across the world, even in the UK and in Nigeria, you can see that dentistry, there's so many, it is always limited the amount of dentists and dental teaching hospitals per se that you find across any given population. And that's because dentistry is so expensive to teach, and it's so expensive to even supervise, and it's expensive to run generally. So you don't always find, like, for five medical practices, you find probably one dental practice, if any, in any given area. So the first difficulty that I experienced was actually getting a place. Because in Nigeria, it was funny because by the time I graduated, my dad died. My dad actually died the year that I was writing my final exams. I don't know how I passed, but we give all glory to God, because I was taking care of him and all of that. So after my dad passed, and he was the one in the house that had all the connections and all of that, there were no connections to get me into my choices for house job per se. So I went through, the normal, the straight and narrow route.
Percent.
So, for example, I went to places like OAU, TH, and guess what? OAU, TH, you write an exam, you will get the results of that exam immediately, and they'll write your names based on how well you passed. So, I was the second best in OAU, TH housemanship exams, and we also even filed in for the spoken interview with how well you passed and all of that, and I answered all my questions. You won't believe that till date, almost how many years later, AETH never got back to me. They said, "Oh, don't worry. Everyone who did well will get back to you
In their usual
with
way.
the offer and a job and all of that." So that's just to give you an idea. And this was the same experience in multiple places. Like, I went to places, I sat the exams, I did very well, but because there was no extra connection or greasing of palms or whatever. I'm sorry to be saying all this on your podcast.
It's fine.
But anyway, so because that was the first challenge I faced. So it
Mhm.
felt very bad. It felt very weird for me, because I'd been used to, if you study hard enough, you will pass, you will
Merit.
do well, and you will just get what you want. But that didn't work out for me, early on. So it took me, I think, 6 months after graduation. I was working somewhere else for a bit, but it took me 6 whole months to start my housemanship. So when I started, funny enough, 'cause I have so many stories. When I started the house job, I was working at in Delta State, actually, the teaching hospital in Delta State. I was the only dental house officer. And that meant that I was on call 247, 365 days of the week. And if you know Delta State, they have very rough, so there are a lot of oral and maxillofacial issues. And you know that there's a branch of dentistry called oral and maxillofacial surgery that deal with surgeries, face, head and neck surgeries basically, but they don't touch the brain and all of that. That's obviously neurosurgery. But any other thing, face, neck, and all of that, is most likely a dentist who has qualified as a consultant, oral and maxillofacial surgeon that will do that. So in Delsuit, we had our most, dominated department, like the most popular department was actually our oral and maxillofacial surgery. We had other smaller departments in dentistry, but that was the one that had the most consultants, most registrars, and all of that. And I was the only house officer. So this meant that every night and I can tell you for a fact, every night I was called for one thing or the other. They shot someone in the
Yes.
zygoma, or they shot someone here, or they blew someone's ear off, or oh my god, and all of that. Many times, anything that happens in the face, you'd have to write consults everywhere because ENT may want to get involved. You may have to check stuff with neuro. You may have to. It was when I tell you that in my house, when I finished my house job, I felt like I was ready to open a dental practice on my own because I had learned so many skills. I was throwing stitches on my own in the A&E by myself. I was learning so many maneuvers that like someone who had done a regular house job in maybe a big hospital with, where they don't just have people coming in with so many things. And another thing in Delta State, they had the highest rate of cleft lip and palate. Cleft lip and palate, many dentists, and I must say, even in the UK, there are dentists who have never seen cleft lip and palate. They don't even know how to handle even like the dental side of cleft lip, not to talk about the surgical side. But I was seeing cleft lip and palate like bread and butter in Delsuit. So I learned some rugged dentistry in Delta State, but I really appreciated it. I think at the end of the day, it made me a better dentist. I was more well rounded. By the time I went on to do my NYSC, I did that in Abuja. And when I was working in one of the hospitals there, I was better than their like the senior dentist that was there. I was better at doing manual work. Like the dental nurses will be pushing everything. Dr. Ampi, come and do this one now. You come on, that kind of thing. They were going behind the senior dentist back to give me all the work, which was not, very good for my work-life balance. But at the end of the day, yeah, so it's been a mix of things, a few hurdles, but in all, I think despite the limitations, it was still a very good choice at the end of the day, and I wouldn't trade it for anything.
Yeah. So looking at all of these experiences, right, how would you say they have sort of shaped or prepared you for your current role which you're in now?
Okay. So I have, well, two roles, just to clarify. So I'm a
Yeah.
public health specialist in oral health with Swindon Borough Council, and then I work as a Core 20 Plus ambassador with NHS England. And that work as a Core 20 Plus ambassador is like a voluntary role. So it's not like
Yeah.
we're being exactly. So it's just a program where you come in and you contribute to health, solving health inequalities as much as possible. You have to do a project, and at the end of the day, you would be writing like a report for that project. But in my main role as a public health specialist in a local authority area, I think one of the things that has really contributed to my ability to do that role and do it well is that fast paced environment and that changing environment that I experienced as a house officer, even when I went on to do my youth service and when I practiced for a bit, and all the things that I did in between. I think just being able to work in a fast paced environment and not get overwhelmed, not get so pressured that you can't move,
Yeah.
because there are people who pressure causes them to just freeze. I don't ever get into a frozen state. I know how to manage myself when there's changes, rapid changes. And I say this to say because in my current role, in the last 3, 4 months, thereabout, we've had three directors of public health had very quick successions, very quick changes. We're experiencing some form of change at the moment. So this is something that a lot of people are currently like, we don't know what to do. I don't know what I'm going to do, because you need that leadership, you need that presence of someone and all of that, that stability to make you feel like you are doing your job well and all of that. However, for me, because I'm already used to a fast paced environment where things change rapidly, where situations can change at any point, I'm unfazed. And, my managers ask me, oh, how are you working? How's everything? I'm like, I'm fine. I'm okay. Everything is fine. So exactly, like I can adapt very quickly. And I think that's one thing that all my experience has really given me, that ability to just adapt and move despite whatever is going on.
That's
Yeah.
good to hear. So, I mean, for
Thank you.
those of us who are Niger, so it's still a positive stuff. It's tough, but
Yes.
yeah, it all adds up, really. So, you've moved from clinical dentistry, you're now in the public health space. So, what was your motivation for that transition, that shift?
Oh, okay. So for me, the motivation really came when, because initially I never thought I would do any masters. to start with. I thought I would go through the normal route, go through specialty or residency training, become a consultant because I wanted to do oral and maxillofacial surgery, still very close to my heart. And that was my plan initially. So when um I started interacting with a few people. There were a few people I started interacting, and I think again when I met my husband, he was ready to do things like his masters. I think I'd already done a masters. He wanted to do a PhD. I started seeing and reading up some of like the actual benefits of doing an MSc and how you can diversify. You don't have to just go the straight and narrow path and all of that. And I think it's really good to have those type of influences in your life where there are people that can say to you, oh, you don't have to sit in the box. You don't have to just think inside that box and remain there and just say to yourself, this is how it has always been. And this, no, sometimes you have to think outside the box. So I think those influences really started making me consider, okay, what else can I do? What other skills can I have? So that, if I find myself in a desert, for example, where there's no dentistry to do, what else will bring me some sort of
It's a great analogy.
fulfillment? What else will bring me even income? And what else will I say that I have achieved? So that was how I started looking at different types of master's routes and different types of things to do. And by the time I studied, because I looked at, I think there was something I looked at healthcare management as well.
Yeah.
I looked at that, but when I read up about it, it just did not seem
Yeah.
like it just didn't seem like what would fit me per se. So I then started looking again and I found the masters in public health. But apart from, having those influences, I also did there were some little part times during my career that I actually did some public health work.
Okay.
So I used to work with it's a very long name, CHICOF, that's Clinton Health Access Initiative, something, something, something in Nigeria. I got selected to do a project in Nigeria. And that was one of my first real times of doing international public health work. Going out, we were doing what data collection, we were trying to get the whole point of that project apparently was to try and get like safer medicines into the community because we went out, we were going to places like PPMVs, so patent and proprietary medicine vendors, in all those interior villages, rural places. And I think it was in Delta State that we did that. And we were seeing that, people were mixing all sorts inside medications. A lot of youths were hooked on tramadol. They were getting it just by the side. There were so many things that project opened my eyes to. So I think that's the first time that I encountered public health and encountered it in a different dimension from the usual community outreach and all of that. So I think that also really started to motivate me. And that's why by the time I started studying and seeing what public health was all about, I was like, oh, this is probably more me than healthcare management or all the other options. Yeah.
So now you picked MPH, that's public health and public health promotion, right? Are
Yes.
there particular skills or values or insights that you sort of glean from the course that you're finding useful now in your practice?
I'm finding everything useful. So I did an MSc, a master's in health promotion, in public health and health promotion.
Yeah.
And it's a little bit different from an MPH because MPH will give you some sort of hands on practice and
Okay.
all of that. You will have like some practical aspects to it. But what I really loved about my MSc was that it had all the modules. I can't find one module that I would say is not helping me right now. So I did things like health protection, health promotion, ethics in public health, the health, public health nutrition, all those modules, even doing public health research. Because currently I'm doing there are things that we do in practice right now, like in my role, things like health needs assessment, things like a health impact assessment, different things like that, or a joint strategic needs assessment, all those type of things. To be fair, where I properly learned about how to do things like that was actually in my MSc program. So I think everything that's taught has really, really helped me. Let me give you another example. So when I started looking for roles and trying to break into the public health space, I applied for a role and I had a lot of audacity. I don't know where that audacity came from. I applied for a lead health protection role, like to be a health protection lead in a city council somewhere in the north. And they actually invited me for the interview. I was shocked to start with, as at that time, I only had care work and dentistry in my CV, and then the public health I had done a little bit in the past. So when they invited me for that, and it was for health protection, like I said, I had not done any practical experience of health protection. But when I tell you that I was the people's choice for that role in terms
Oh
of the
wow.
panel and all of that, it was because I had gone back and I read my health protection presentation, everything that I had gone back to read the basics of health protection. I'd gone back to read about how to do all those health impact assessment. I'd gone to read about health in all policies approach, all of those things. When I had read them and digested them before the interview, when I went to the interview, they asked me some questions. They actually also asked me something that will show whether I have the skill or the ability to do things like a health impact assessment. And when I started talking about it from all my book knowledge, they were so impressed. And obviously, and then in terms of like confidence, being jovial, talking to them, and all of that. The only reason why they didn't give me that role, and I must tell you, the consultant called me and said to me, you know what? We're going to still keep you on file if there's another role. And if you want us to refer you somewhere, we're happy to. You were actually the person that everybody wanted, including the person that was leaving the job that was part of the
Okay.
interview panel. You're the person everyone wanted, but just because you don't have that documented health protection experience in your CV, that's why we couldn't give you a lead role. So that I took that in good faith because it meant that, my knowledge was not a waste. My, I felt recognized. I felt like, okay, everything I was taught in Swansea University, actually, I didn't waste my time there. So I must tell you, every single part of the public health course as a whole, I think it translates to what you actually do in the public health space, especially even in local authority. It really translates because I know in the NHS, they tend to do a bit more of healthcare public health. But when you come to like local authority or a voluntary sector, a charity organization doing public health in those type of areas, you will find yourself doing all those core things that you were actually taught in school. So it's really, I must say, I'm very pleased that I did
Yeah.
that in
Okay. I
this.
think it makes a lot of sense really because again, some people will argue that yeah, the sometimes the money you pay for the courses is not really worth it because you might not probably find it useful in what you're doing. But I think it's refreshing to hear a different perspective to say yes, everything you sort of learned is helpful in your course. I mean, I think I was speaking to somebody the other day. I mean, everything I did in health informatics, that is what I'm using, today, my day to day, and it makes a lot of sense.
I see.
Yeah. Then when you look at your time in Swansea, right, the way
Yeah,
you came in as international student, what
yeah.
challenges did you face with the UK academic environment? Was there any different? How did you
Oh,
navigate
yeah.
that?
So first of all, there was a very clear difference in the UK in comparison to Nigeria in terms of, how do I describe it? So normally in Nigeria, the expectation when you are writing an exam is you read, you cram on whatever you do to get the stuff in your brain and you pour it. You cram and pour. There's no room for, let me think critically. Do I actually believe that what this person is saying, what I've read in this book is right or not? But the first difference I noticed when I got here was that they want you to think and to
Critical
argue
thinking.
exactly that critical. Like I would before I came here, I felt like I was a critical thinker, right? But I had not seen it to like this dimension to the point where it even needs to go into your assignments, it needs to go into your tests. You don't just come and pour what you think you've read. You need to explain and give, a lot of reasons why something should be correct or something should not be correct.
Very
And
valid.
again, another part that I think I started to struggle with was when we came to public health ethics. So, you have to talk about basically like morality. There were so many dimensions to public health ethics. And amazingly, I had this lecturer who was against certain things that are normal public health stuff. So, for example, I had this lecturer who did not like screening because if you argue it ethically, there are many reasons that you can say screening is not good, but please do not quote me anywhere. Go do your screening. But I'm just telling you, like finding that immediate type of, I won't say it's a culture shock, but finding those type of little things along the way, which are not things you will find normally in the Nigerian space, because you only find people who are like, okay, let's do the things the right way that is meant to be done. Don't need to think outside the box and things like that. So I think that was the first struggle in quotes that I had, in coming to the UK. But at the end of the day, because Nigeria teaches you one thing, able if Nigeria teaches you anything, it's being able to adapt to whatever is happening in your life. I had to adapt quickly, start being able to do all those things that were expected of me. Yeah.
Okay. Now, a lot of doctors, a lot of students struggle to secure jobs, after their studies. And I think I found a lot of people who sort of finish MPA and they are sort of stuck. So, what next after my MPA? So, looking at your own experience, how did you sort of approach your job search and how are you able to land a role effectively?
Okay. Can you still hear me?
Yes, I can hear you. Yeah.
Okay, fantastic. So when it comes to the job search, I think the first thing that I struggled with and which has now changed in my life is having audacity. And I must say this with all humility. I'm telling you this, half of the time, and I learned this very early after a lot of wasted years, let's call it that, because the first thing that happened when we came in was that, we heard and we bought into that lie that, you can't do anything with public health. Oh. You are just, there's no job outside, there's no this, there's no that, nobody is giving anybody, there was a lot of talk that kind of made me think maybe there's no job. Maybe just do what everybody else is doing. Maybe just, do the care work and move on and just rest. But I find that, having knowledge and having that audacity to say, I don't want to follow the bandwagon. I want to try. Let me, even if I fail at the end of the
At
day,
least I tried.
it's better that I have tried than that I didn't try at all. I think I had to come to that point of having that understanding before things started changing for me in the job seeking space. Because before, I wasn't trying. I must tell you the truth. I wasn't trying. I was just sitting down in the care work and another thing, a trap with care is when you find a low stress, high paying care job. That is a recipe for you to get stuck and stagnant. I found a high paying, low stress care job that, I was basically chilling, doing my work, and I was seeing money. And I'm telling you, like good money. I'm not talking
Yeah.
about all these £12. As like I was seeing good money. I was okay, I was fine. And in my mind, it was like, what else? What are you living? What else do you need job wise? But I had to speak to myself. I had to come out of that rot. I had to come out of that stagnancy because one thing I realized very sadly was that I started losing my skills. So all these dentistry skills I've been telling you how I was throwing stitches and doing all that,
Everything was just disappearing.
2 years after doing care, I was forgetting definitions of basic things in dentistry. There were things that I found out that like I'm losing my understanding of some things. And that's because the truth is that if you're not moving forward, you're moving backward. Something is leaving you. Whether you think, oh no, I'm just in one place for it. No, if you stand still for too long, you will lose something. So that's what, it came like a rude awakening. I was like, what are you doing here? I had to like ask myself, what are you doing here? So it was that first, eye opener that made me say, okay, I must start looking for jobs and I must start, diving into it and seeing whatever is there to be seen. I must research, do my best and see what I can get out of it. So that's how I started looking for jobs. And one thing about me is that I'm a very curious person. So I will start researching and researching and researching. So that was how I started finding places to do, places to even get certain types of jobs like council jobs. There are dedicated websites. There are places like Jobs Go Public, your local council.com, different types of websites where you can go to and see only like local government jobs or local authority or council jobs, even civil service jobs, all sorts of places that you can go to and find those type of jobs. That was the first thing. Secondly, I began to see that it's not just enough to rest on my laurels and say, oh, I'm a dentist, I have masters in public health. We are many like that. If you check LinkedIn, we are many. Just check dentist plus MPH. All of we gather there. So you have to be different. What makes you different from the next dentist from MPH is that you learn soft skills and you have professional courses under your belt. You can say, I have the knowledge from this, I have the knowledge from that. That was how I did Prince 2. When my husband initially, and sorry, I always say my husband, but he has been a very strong source of influence and
Shout out to him.
knowledge for me, and big ups to him. So when he did Prince 2, when we first came here for free in Wales, I was like, what's my business with Prince 2? What are they printing there? It was after some time I realized, no, you have to diversify your skills. You need to know things more than other, as in not more than other people, but you have to have something else in your repertoire that will make you stand out. So I went and I did the Prince 2 course, did the foundation and the practitioner, passed it and got that. I started, after doing that Prince 2, it was like I got hungry for more courses. I started finding free courses everywhere. I could find them. If they say, oh, this is a course that I'm making every contact count, I'll go and do it. If they say, oh, commercial determinants in public health is the new thing that is reigning, I'll go and do the course in it. If they say it's infection prevention and control from RSPH, I will go and do it.
That's way.
In the same vein, I started also looking at where else can I get affiliations that will make me stand out as a professional in my field. So I found, the Royal Society for Public Health, the UK Faculty of Public Health. You can actually become an associate member. You don't have to wait till you write the exams and become a member or a fellow by nomination and all. You can pay and become an associate member of the Faculty of Public Health. Then Royal Society of Public Health, I'm currently a fellow of the Royal Society. These are things that I didn't know nobody came and told me this is the link, apply to it.
It was
I
a lot
was
of
just
research.
researching, doing my best, getting information as I could, and just putting in. I had that mindset of, if I perish, I perish. If it doesn't work out, it doesn't work out. But at least
At
I
least you gave
tried.
it a go. Yeah.
So that's how I put my fingers in a lot of pies, just because just because of that type of mindset. And that, I feel like all those things, when I finally, got this my current role, I must say those were the things that distinguished me, because my manager, who was the person that was heading the recruitment then, was like, she kept like, am I a dentist? And I have project management experience and certification, and I have this and I have that, to the point that I did training in freedom to speak up with the National Guardian's Office.
Yeah.
And ask me where I'm using the training for freedom to speak up. It doesn't matter. I just have the one.
You just did it.
So really, that's I think that's just what has really helped me. And I think that helped me to stand out early on in the job applications. Then again, there are always challenges that happen. Even when you have all the skills and all the whatever in the world, there will always be one or two or 100 unfortunately. But initially when I first started receiving unfortunately, I was like, I would cry. Be like, after I wasted my time, these stupid people, like, I would insult the people. Why? Why will you tell? Anyway, I've grown and I've matured now, Dr. Ron. I'm a better person. I have learned that there is no need, like, no matter what level you are, and I must tell you this, even my manager was saying to me that she applied for a job, and this is someone that has donkey years of experience in public health. She applied to a job, and they gave her unfortunately as my manager. as a head of service
Everybody
in
will
public health.
collect now. Everybody
She
can
was telling
collect.
me, "Hi, I can't hear you very well. Sorry."
Can you hear me now?
No, I can't hear you now. I've lost. Sorry. I think something has happened.
But I can hear you.
Oh, no. Sorry, I can't hear you.
And it's unfortunately you get. So
Saying,
just like you said, your manager still applied and got. That even sort of reminds me when I was even doing my own job. I mean, it was steady, unfortunately.
really?
And part of the downside of that, unfortunately, is you start to begin to doubt yourself to say, is it that
Exactly.
I'm not fit for this role or I can't do
Exactly.
this job? And you're like, but I read the job description. This is something I can do. But it just keeps coming back to back to back to back.
Exactly. Like, there are many roles I can tell you that I'm sure I could have done like the back of my hand. Yet, you gave me unfortunately. But
Unfortunately.
the truth is, I realize that even now, as someone who has also like interviewed people and had to give people, unfortunately, I've started to understand that it's not just about sometimes, and I must say this, in this current climate, the job market is actually really saturated. Like, you can throw a penny and you will find people, 100 people that have the same certification. Like, then you throw that penny further, you will find 50 out of that 100 that have that same certification plus an extra certification. You will, like, it is a very difficult thing. So many times the unfortunate is not that you're not good enough. It's just that there's just somebody who has maybe added
It's better.
the
An extra.
maybe some experience or something else that just aligns better. So it's not a problem of me. It is the problem of what is the current pool of candidates in that
Yeah.
place. So I had to learn that quickly. I had to start learning that it's not, but you're not bad. You're not not good enough. No, it's just that in life, you're not the best things in sliced bread. In life,
Yeah.
there will always still be people who have something or the other that is makes them more advantageous to that organization at that time
Alright.
over you. So it's just life. You move on. It's
I remember
hard
you
though.
said
It's harder
very
to say.
hard.
It's harder to do than to say. But when you have enough opportunities in your life, it's either you cry or you pick yourself up and try again.
Seriously. I mean, it also reminds me when I wasn't very keen on doing the sprints too that you did, But when I started getting some opportunity and I got some feedback to say, okay, yeah, you're good, blah, 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 blah. But, we
Mm,
had this candidate
that bot.
who's got this. I'm like, okay, maybe it's time to add an extra layer to what it is that you think you have in your portfolio.
Yeah.
When you look at your transition journey now, were there any moments where you sort of doubted yourself, or how did you just navigate
My dear, I doubted imposter syndrome is a
that?
horrible thing. I must tell you. See, I doubted myself. Leave all that audacity I had when I was applying for the jobs, oh, because I was applying for jobs that I wasn't even sure I could do. Imagine me in my care workplace applying for public health specialist, not officer, not practitioner. I was applying
Specialist.
for specialist grade. Anyway, I think I had all that audacity doing the applications, doing the interview. I was talking with confidence, all of that. When it came to do the actual job, because that is where people don't always prepare for. You are
Yeah.
prepared for interview, you are prepared for the CV, you have optimized and over optimized CV, you have packaged and repackaged. No, that's the truth. But you don't prepare to do the actual work. So when it comes in, and the thing is, as a public health specialist, there are a lot of decisions that are autonomous, that lie and rest within you. You have to make the decision. And then what comes of it, comes of it. If it's bad, so be it. If it's good, you get some praise.
Mhm.
So I didn't prepare to do the actual work. I didn't add all that energy and effort into doing the actual work. I felt, I'll come in, have some training and all that. It's a lie. There's no training called public health specialist mandatory training. The mandatory training in a local authority or in any place is usually generic things. EDI,
Yeah.
know how to do this, know how to act as a manager, know how leadership and trade. Nobody actually trains you to do that work because you have package and repackage and say you can do it.
I can
Come
do
and
the
actually
job.
do it. And there's no And then in my own case, it was extra frustrating because my role was new. That was the first role of its kind in the whole of Swindon Borough Council. So I
Wow.
didn't have someone that will say, okay, this is a handover note. You are handing over to me. This is what has been done. There was no handover note. But luckily, I have a very good manager who actually drew up a work plan for me to help me settle in a little bit easier.
Okay.
But not everyone will be that privileged, you know.
Fortunate, yeah.
So, how do you handle yourself in that transition period, especially because you don't have any particular experience that is exactly the same as what you are coming in, you're transitioning in to do. So, you can't say, I did it like this at my last place, so this is what I'll use. That's the idea I will use now to do it here. There's nothing like that. You don't have any means of reference, any point of reference that you say, this is, yeah, I will replicate what I did here, there, in this place. So that's the problem with transitions. We don't actually prepare to work after that transition has happened. We don't prepare for that level of, that difference in our work
Yeah.
pattern, in the way we do things. So I think that was a very, very difficult and challenging thing, but I had to, again, get it very quick. I feel like if
Mm.
you have some of those basics in terms of being able to adapt quickly and being able to handle yourself even when there's a lot of change going on, if you're able to manage change properly, I think you will transition to any role you want to transition to without a problem. Because yes, problems will come, but what I mean is it will not derail you. It will now stop you from doing what you want to do, and from excelling in, your new career. So
What you,
yeah,
what you just said now is sort of, you know, I mean, I've spoken to other people who have transitioned into other areas, and it's like a recurring thing because people sort of underestimate the challenges of career transitions or pivots, right?
yeah.
And it might look easy or seamless on the front, but we know what happens, like behind the scenes, really.
Oh my
Because
god.
I know when I got newly into this space, I was asking myself, what are you even doing?
Exactly. What's really happening?
What is going on?
What's going
I
on?
remember days when I would attend meetings, I would just be taking notes, all the jargons. I don't even understand what they're saying.
My
I
god, the
just kept taking
acronyms
notes.
that you
Exactly.
don't know from Jack. Hey.
I'll spend countless nights on YouTube trying to figure out, okay, this is what this actually means. Oh, this is what this actually means. So that steep curve is always there. In
Yeah.
as much as, yeah, it looks like, okay, they are doing it easily, in quotes, but
Yeah.
it comes with a lot of challenges. Like you said, being very flexible, adaptable, able to like think on your feet
Mm.
very quickly usually helps you sort of navigate that change. And
Yes.
also being able to know that you need to put in a lot of work because a lot of people underestimate the amount of work that goes into transition,
Yes.
especially that research part, a lot of reading and
A
reading
lot of, and I
and
must,
reading.
let me give you this example. Sorry to
No
interrupt.
problem.
Yeah. So you need to, I feel like I must say this to anyone who is transitioning. You need to read, get in there like you are going to be interrogated or interviewed again.
Yeah.
Because my first day of work, I came into work, there was the normal introduction. So, oh, this is Ambi. She's our new public health specialist in this. And you will not believe it, especially in the public health space, because there are always a lot of people who want to show their knowledge in public health. They want to, ask you some deep questions. The kind of questions I was getting on my first day, I was like, who did I offend? I just
We
arrived.
are the specialists now, so why are you complaining?
My dear, I said I just arrived. Can you people? They were asking, okay, so what is your strategy for doing this? And I cannot forget the person that asked me these questions. He said, what is your strategy? What do you think would be the most effective way to start to target, some of our vulnerable population groups in terms of the oral? Brother, I just arrived. Allow me to even rest.
There's no time, no time, no time.
So you need to read. What helped me to answer those questions was that, I just said some things. And then again, having that background as a dentist, that was what I used to shine first. I explained, there were certain things that I just, picked up from my previous knowledge and, my experience doing like some sort of community outreach and public health stuff in the past. That was what I
Mm.
actually then used to answer that question. But I didn't have, like, if you ask me that question now, I know what to say. I didn't have like a plan. Like, I didn't have, anybody that heard me reply to that question will know that I was rambling. I was trying to
Yeah, struggling
just
to
find one or
fit
few
things
things to
together.
say. Exactly. And there are a lot of people, it always happens in public health. There are a lot of people that would test, want to know, why did they give you the job?
The
I
job, yeah.
remember a consultant from NHS England that was one of the people I had to introduce myself to as a new public health specialist. And oh my God, for the 1 hour of our introduction, she was like, okay, so are you registered in the specialist list of the General Dental Council? I'm like, no, I am not. Are you this? What is your 5 year plan? Like, God, I've already gotten the job. Can you let me rest?
Give me a
What is
break.
my
Let
five
me
year plan again? Anyway, I say all this to say you should read before you actually research as much as you can. Have a clear, sort of plan. It doesn't have to be the most robust plan ever, but just
something
have something that
baseline.
exactly have something cogent that you can say.
So what does your typical day to day look like as a public health specialist in?
My days are always a bit different, but I think there are a few commonalities across the week. So I will just highlight some of those. Typically, if it's on a day that I'm working from home, because I usually work from home most of the time and then one day in the office. If it's on a day that I'm working from home, I will obviously many times I will start with a number of meetings because it does tend to happen that I arrange my meetings on more on days that I'm working from home than on days that I'm
Okay.
in the office, so that I can actually use the office time for some better things. So if I'm at home, I'll obviously probably start with a one or two meetings because I always have some very early meetings. Those meetings can range from project planning meetings to talking to external stakeholders. It could range to regional meetings or even national meetings. It depends on what is happening. So there are many varied things that happen. And when you're a public health specialist, you are supposed to be abreast and you're supposed to be on top of multiple work streams. So you find yourself throughout a day, you can check in on one project, start another project, check in on another one, go and end another project and end the day commissioning something or trying to commission something because it takes a long time to commission things in local authority space. So a typical day could be a mix of different things, but many times that first starts with a meeting. But as the day goes on, usually I try to protect some time in my diary per day to
Okay.
catch up on work that I'm meant to do or I've been assigned to do, or things that maybe during my one-to-one were highlighted as things that are under my own action plan to complete. I like to protect time in my diary to do those things. So I just take some time, go back to my notes, and then have that focus time to complete any actions. And it can be anything. It can be small actions, like, because I like to write everything down. So have a very cool gadget called a Remarkable. It's like a paper
I've
tablet.
heard too much about Remarkable.
Yes, it's amazing. It's a very nice paper tablet, and it keeps all your notes in like one place, so you can just click public health notes and everything will come out. I can click for my checklist. I can check things off because I like checking things off. Being
Yeah.
able to say to myself, I've done this, yeah. And it can be anything from, send an email to so person, follow up on this, chase on this, do and that, like that. So I do all of that, all those minor tasks, paperwork and things like that. A typical week could also include times in the afternoons where I have maybe what we call journal club, or one intra-organizational meeting or something like that. So what I mean is, so maybe something that we organize amongst ourselves, maybe like a monthly catch-up for all the specialists that work in the council, or a journal club, like I said, where we come together and just talk about articles, review them using the CAST framework and things like that, and just, keep ourselves abreast of public health research. So many afternoons are spent doing one or two things like that, or one or two meetings like that, or actually just taking time off and having a break from the desk and all. And after that, towards the ending of my day, I usually just mostly maybe catch up on some of my projects, try to ensure that I have filled in and kept myself up to date. Because many times as a Prince 2 practitioner, I try to apply some
Yeah.
of those Prince 2 practices and
Very
principles
necessary.
in what I'm doing exactly. So I have some like different like Gantt charts, Excel sheets, things that keep me on track of certain stages of every project that we're doing.
Yeah.
So I try to make sure that I know where we are at the end of the day. So towards the end of the day, I usually try to, fill in. If I need to update something, I'll update something. If I need to refresh my knowledge on what we're doing. And this is because many times, let's say the next day you have a team meeting and people like to put in the 30 minutes before that team meeting is when they want to catch up on everything that happened
Every whole
before,
thing.
and you will rush and you will forget and you will end up sounding like someone that does not know what they are doing.
Mhm.
So I usually leave that to like the end of my working day to do things like that. And then once in a while, there's always one or two emergencies that occur. And emergencies as a public health specialist is not like emergency that you know in medicine. What I just mean is that there's many times when, especially in local authority, you're working in a political space, things can shift and change at any point in time. A change in government many times comes with different things associated with it. So sometimes the plan that you have been planning for, something you have been working on for so long, just because there's been a change in leadership, everything, all your work will just crumble. And that's the end. They say, oh, there's a new direction. We want to go this way with this
Yeah.
idea. So those are things I refer to as emergencies, like urgent things that you need to, ensure that maybe you are knowledgeable about one, you are able to action whatever consequences come out of that quickly and apply that to, your project or to whoever you're working with. So those type of emergencies tend to occur, once in a while, not all the time, but they tend to occur. If you're working in health protection, it will occur almost all the time because in the health protection space, there are other things like being on call and all of that. When there's a report of some outbreak or the other, one thing or the other going on, you receive all those alerts. So you have to be on your toes when it comes to health protection. And I say this because I've done a little bit of a stint in the health protection space, throughout my work here. But apart from that, if you're not doing health protection, emergencies just refer to things that are urgent, that need to be quickly transitioned, or things that need to be quickly worked on, before you end your day. And I'll say that's a typical day. During a week when maybe I have to actually go out into the community, because there are many weeks when you have to do something in the community or the other, because sometimes you commission a project and you want to be in the sphere of whatever you're doing to make sure that things are going well. I remember at the start of one of the projects we did in Swindon with asylum seekers and refugees, I actually had to go out to the hotel where the refugees were, and I had to like deliver a talk there for a few hours and, have like a drop-in session with them. So there are once in a while that things like that come out. But again, for me, I would not schedule such a thing like on a day that I'm working from home, because I don't like to interrupt my flow. So if I'm working from home, I like to
Yeah.
just sit home, do my thing, know that I'm finishing at home, not that I'm working from home, jumping outside and then jumping back. Exactly. So I try to, but obviously, the world is not perfect. There will always be times when all those things creep into when you don't want it to happen. Many times I try to ensure that, if I'm in the office, I'll go out and do all the other things I need to do in the community as well. So I think in a nutshell, that's what it.
What parts or what elements of this role sort of excites you the most? Where you look at everything you
Oh,
do end to
it
end.
is, for me, it is actually the delivery of the projects that we commission. So there are a number of, the thing about public health is that many times is a field where it's a thankless job. You don't, you know how when you're practicing clinically now, they'll be, doctor, thank you. Oh, I'm feeling better now. Oh, my teeth is not failing me again, or things like that. Or they'll come back and buy you small wine. You'll be so happy throughout the day. Nothing like that in public health. They will even insult you in the papers. So the that I will say I really enjoy is getting the opportunity, which doesn't always happen, because if you're a bit higher up in the scale, you work more strategically than operationally. So that's the problem. When you're a specialist, you're expected to be working, the strategic point of things,
Strategy.
thinking of things, doing all those analysis, the critical thinking, commissioning the work, giving the approvals, managing the budgets and all of that. But you're not actually expected to be on the ground most of the time. But what are the benefit that I have had is that as the oral health lead in where I work, I don't have one person that's like under me. I work with different practitioners that are actually dedicated in other areas, but I don't have
Areas, okay.
an oral health practitioner in my workplace that is like reporting to me directly. So once in a while, when those operational bits need to be done, so going out into a place and we can't get anyone else to do it, I'm always like, yes, I volunteer. I volunteer because I like to go out and actually see that change that I'm leading to, all those things, that impact that I'm having with my work. I want to actually go out and see it. So that's the bit that I enjoy the most, having the opportunity to step out of the office and go to a community center. You start to see that, all your misconceptions about people and how the world is will change dramatically when you go out into certain places. Like I've been to certain vulnerable populations. I've been to places where, people have with substance use issues, are
Yeah.
people who are experiencing homelessness, people who are experiencing some form of food poverty or fuel poverty or the other. And when you come into places like that, you'll be humbled. You will start to realize that the world is not what you think it is. Just because you see everybody walking around and they're happy, it does not mean that they're not facing multiple challenges, in their lives. So that's the part I really enjoy. Really. It's not all the meetings. I like going out. I like going out. I'm telling you, I like getting my hands dirty, doing the actual work.
Yeah.
So
When you compare your time, as a core dentist or clinical professional,
yeah.
then you look at this other side. What skills would you say are still sort of relevant or from your clinical background
Oh yeah. I
in the
think
work you do?
wow. I think there are a number of skills that are still relevant. I feel like there are a number. Okay, firstly, as a clinical dentist, you have to think on your feet. You have to be critical, and you
Yeah,
have to analyze multiple options. Do an options appraisal, for lack of a better word, where before you decide on certain things. Because as we all know, once you make one mistake or the other, it can go very wrong for the patient.
absolutely.
That skill is something that translates very clearly into public health. The only difference is that it's not as fast paced as it is in the clinical side.
Hospital.
Because in the clinical side, your patient is looking at you and saying, Doctor, oh yeah, tell me,
Okay.
what should I do? But in the public health side, you have some time to do those things. You can take 3 months, 6 months doing an options appraisal. You can take some time, think critically, present up the options and all of that. But when it comes down to it, the skill is still the same thing. It's just that you now have more time to practice the skill properly in the public health space. Then again, clinically, I think there's one thing that we all know that we do a lot clinically and that is you read a lot. You have to keep on top of the knowledge because Dr. Google is not helping anybody. The patient will
Mhm.
come to you and tell you, Google said that I have an abscess, when I can see that you don't have any abscess, or I can see that you probably have a cyst or a tumor growing somewhere. And
Mhm.
this used to happen. Oh my God. During my house job, Delta people can argue. They say, okay, no, not be like that. So it's not that. That thing you are saying is not what I have. I say, sir, this is what. But anyway, let's not digress.
Yeah.
What I'm just trying to say is having that knowledge, having diverse knowledge and understanding is so important. And I think it translates to public health practice because there's so many things that are always cropping up in public health, especially. I feel like that skill, that diverse knowledge, having that skill is actually expanded in public health because you're always have to be reading. One white paper or the other will come out somewhere saying you need to devolve and do one thing or the other. There's always something coming out. There's always another research saying that what you were prescribing or offering before is no longer it. Do you understand? So I think that same skill, it translates very clearly in public health. That's something you always have to be on top of your game, reading and all. Being able to, I think communication is another skill that translates in public health. And this one is a big one for me. As a clinical, dentist, this is another one where, in the clinical side is a bit toned down, you can just tell the patient, if you're not able to talk to the patient will just say, that doctor doesn't know how to talk well. That doctor, look at her, just tell them your father has died. The consequences of lack of poor communication in the clinical side is not as bad sometimes as it is in the public health side. That's why I say you still need to have those skills, but you need to expand it in public health. So in public health, you need to be as fluent as possible, eloquent as possible, and you need to be able to adapt your language style to fit the audience you are talking to. And this is something I'm saying it so clearly because I struggled with it. Clinically, we're used to all the jargon, this and that, and some
Motility,
inflammation and
mortality,
all the
all those.
ITs and all the things that you write when you're writing up a report and all that. In public health, you need to know how to write reports and who that audience is that will read your report to know how to write it well. So, for example, my first briefing note, and I can give you the link to that briefing note. I wrote that briefing note like 3 times because the first one I wrote, I was like, oral health is a problem. This and that one, dental caries. This, I was just writing like I'm talking to some academic fellows. But they told me, my manager was like, oh, I'm sorry, this is so good, but you need to reduce, like the language needs to become layman language. You need to
Language.
change. You should be telling them, oh, do you know how to take care of your smile? Do you know how to? So I had to learn that very hard. But I feel like obviously if you have the basics in the clinical side, in terms of
Becomes
being able to
easier.
communicate well clinically, you will be able to then, improve that and act on it on the public health side. I think apart from that, there's still a number of skills that I can think of. But I feel like all of them, there's always a difference, but you can translate them across board. So sometimes in the public health space, you may need to use that a bit more than any other skill, but it will still translate at the end of the day. That's what I feel.
What advice do you have for maybe dentists or clinicians who are maybe unsure if public health is the right move for them?
Right. So I'm not the type of person that likes to push people to do what they don't want to do. That's
Yep.
one.
But again, some
But
people also struggle with making that decision.
exactly. So one thing is this, because dentistry, I must tell you, dentistry is very lucrative in the UK. Many dentists that you see who have gone astray here, who have gone to other practices, that is not as in gone to do other things, is not always because, they didn't want to do dentistry again or they found another passion. Many times it's because they've struggled with doing the licensing because it's a bit more different for us in with the General Dental Council to get your license and all that. It's not as easy as just writing PLAB 1 and 2 is
Okay.
for the medical,
Yeah.
colleagues. You have to apply, you have to get approved, you have to do good standing, you have to do so many things before you can even write the exam.
And the
Before you
process
can
is so tedious.
I applied since 2021 and just got approved 2025
Wow.
to write exam. Not that they've given me license.
Wow.
So that is, I'm just trying to tell you, not everyone will have such a delayed journey, but everything is always a bit different. Yeah. So, but for me, in my case particularly, actually, I liked dentistry, but I'm liking what I'm doing much more. So public health has kind of stolen my heart in quote. It's not like you have first love. That's second love. My first love was dentistry, but right now I'm with my second love. I'm sorry, which is public health. So my advice to people would be, first of all, analyze it properly for yourself. Research as much as you can. Find out what the pros and cons are for both, staying in dentistry. Staying in dentistry, there's a lot of money to be made, but are you going to be happy? Are you going to give it all, your all? And are you able to live with any consequences that come in terms of, here it's very easy for litigation to occur. People sue
Mhm.
you for one thing or the other. So many things. I want people to always go into any decision that they make heads on, knowing that they know all the pros and cons and they've still chosen to do that thing. So that's my first advice would be analyze everything, read as much as you can. Lastly, if you think that this is something you would actually want to do and you think you're going to be happy doing it and not looking back, then jump on it, like embrace it. And when I say embrace it with all you have. If you find a role with a charity, whatever it is, go for it. If you find a course somewhere that will impact on your public health, go for it. Embrace it with all you have, and at the end of the day, you'll be happy with it. So I think that's my advice for everybody. Just analyze, be sure that that's what you want, and embrace it. You'll be fine.
Yeah, like I said, I mean, some people find it difficult to, sort of make that decision. I remember then too, I was also stuck between MPH or something else. But I think the only deciding point for me was like, I think there are a lot of people with MPH out there. So I didn't just want to add to that number.
Do you want to become a statistic?
I
Oh,
didn't
that
want to join that,
the bad boy.
number because I think the trend then was, finish med school, do your
Mm,
house job,
mm,
then do an MPH, get into the NGO space. That was what the trajectory looked like,
I see.
But like, no, I don't want to add to that number, please, please, please. I started looking for other things
Other
too.
things, yeah. And which is good. Like I say, it's always good to have that audacity to be able to go for what you actually want. But the point is, make sure you actually want it. Don't just do something because everybody is doing it. Or you saw
Absolutely.
somebody that you think they are looking good and all of that. So probably there's money inside it. No, everyone has where the shoe is pinching them. But if you're passionate about it, you will stay there.
Yeah.
So,
Now, looking at your journey, right? So, I mean, you mentioned a couple of things that sort of, helped you, certifications, being very what's the word now? Is it bold or determined in doing your research,
yeah.
reading and a lot of things? Just curious. We talk a lot about networking, a lot about mentorship, especially when people are trying to pivot or transition.
Yeah.
Has these two things played any role in your own journey?
Right. Thank you for that question. I thought we would not get there. But no, the thing is, I know a lot of people believe in the power of networking. I also believe in the power of networking. But I must tell you very honestly, networking has not gotten me any roles before. And I tell you why I believe in the power of networking, even though it hasn't worked for me, is because on a day to day, I see it working in people's, like people around me. I have networked people to other people and they've gotten roles, they've progressed and all of that. Like even it hits home. Even my husband as well. There's a lot of networking he does on LinkedIn. He's always getting propositions like offers of roles. Oh, can you come and do this? Can you come and do, just because of the people that are in his network and the people that are in his space,
Yeah.
Even him being able to become a senior leader in the ICB and all of that, all from networking and someone telling him, oh, don't worry, you can do a band 8A job. Just go for it. Go for it. I will refer. And that's how he go. I'm telling you. So I have seen networking work, but I just want to remind people that it won't always work for everyone. It won't always, work out the same way for everyone. Some people can have a mentor for years and years and years, and it still doesn't play out the way they think it will work out. So that doesn't mean there's something wrong with you or the people are doing something different or whatever. No, it's just, I feel like when it comes to networking, give it your best, always try. And for me, for example, I started trying to be more vocal on LinkedIn, trying to make sure that I'm connecting with the right people because networking, I think the goal and the key when it comes to networking is that you're networking with the right people and at the right time. The right time, you can't always, have control over that because you never know whether it's the right time when they have a job vacancy in their place, or you don't know whether there's somebody that they know. You can't control the timing, but the right people you can control. Don't just allow anybody to get into your space and you think all network is not network. Because I have seen someone, and no, I'm telling you, I have seen someone whose networking went very wrong and they lost out on a job opportunity just
Wow.
because of that. And I'll give you the example. Someone was applying for a role and it was actually in my council, Swindon Borough Council, and it was also a specialist role. And they had gotten a mentor, someone who wasn't working in the council, but someone who was working somewhere else. And the person had coached them, told them what to do, package CV, do all this, talk to them about how to do their interviews and all of that. And they excelled at the interview stage. The person now said to them, oh, you know what? Find out they're having an event. There was a conference kind of that was going to happen with some like senior leaders, and it was an invitation only conference. It wasn't a global conference, but their mentor had a knowledge of that conference and was going to attend that conference. So the mentor said to her, you know what, come and join me in that conference. I'm sure you even meet the people that interviewed you and things like that. And that's how she went for the conference. And they were like, I thought you declared that you don't have any relationship to any director or
Wow.
anybody that works in this. That was what you declared in your interview.
Wow.
And that was the same thing you declared like in your application form. So how come you are in this invite only
Event.
conference
Wow.
event? And that was how they declined her the job. Because legally, if there's some relationship that
Conflict
has
of
been
interest
undisclosed,
and
a
all of
conflict
that.
of interest that has been undisclosed and all of that, you can't knowingly give somebody like that a role. And she was the best in the interview. And you see, this is now, the mentor didn't do it on purpose. One, it was not like the person was trying to be helpful and to expand her network, to go
Yeah.
and rub shoulders with those that know.
The
But
big boys.
exactly. And the truth is that that particular event happening, if it had happened before her interview, it would have been better than it happening after the interview. You have already been seen, and then you're now going to, it's not as if you're trying to curry favor with those people
Mhm.
in a different setting. So that was the grounds of her disqualification from that interview process. And she lost out on that job. Someone else started doing the job. So I'm just saying all this to say, not all network is network. You need to network with the right people. That is within your control. Try your best to reach out to people that you think have that wealth of knowledge or experience, and just do your best. And some people get annoyed when they reach out to somebody for a mentorship opportunity and the person says, no, sorry, I can't take you under my portfolio, under my wing. And they're like, yeah, why would the person say, especially if it's a fellow Nigerian or someone that knows you or something. And they're like, oh, the person is just proud. And it might not be that. The world does not revolve around you. Just do your best. No, I'm serious. Just do your best and try to diversify your network and people that you know as much as
Mhm.
possible. And then, just let that and hope for the best and see how it plays out. And
Yeah.
again, I just remembered another example. That was why I paused for a minute. No, networking is good. Again, I'll give you a good example. I'm giving you a bad example. Let me give you a good example.
Let's balance it. Yeah.
Yes, let's balance it well. So I met somebody, and I'm still very grateful to this person. I met someone on LinkedIn who just messaged me randomly on LinkedIn. And this person, as at the time, was working in an NHS trust, I think, was a clinical leader. I don't know what they call them, clinical director, clinical leader. I can't remember what the title is, but it was something in social work, but like clinical leader or something like that. So, and this person messaged me, I think saw my graduation stuff, and I don't know how I had followed the person, and just messaged me to say, okay, what is your plan for the future? What are you doing now with your MPH and all of that? And over time, we scheduled a Teams meet. He was like, okay, let me meet you and let's just discuss what are the possible
Yeah.
options. We scheduled that Teams meet and we talked a little bit, showed me some different types of career pathways in
Hmm.
their place. Now,
Interesting.
none of those pathways were ideal for me because obviously this person is in social work. I'm trying to look for something in public health. So it was showing me different things like, oh, do I want to become a physician's associate? Showing me different things. There were a number of them, and I must tell you, there were a number of diverse, roles that I had not seen before that you could actually do. I know as at that time, I was still doing care job, and he was showing me a band 7 role as an eating disorders team leader. I'm like, are you sure that I can do that? Say, yes, your portfolio, you can do it. And it will shock you. I actually applied for the role, and I actually got both the interview. I actually got the role, but because of one issue or the other, and I think I weighed up, it was against this, my public health specialist role, so I took the specialist one. But
Yeah.
I'm just telling you, like, sometimes you need people that will change your mindset, the way you think. You don't always know everything. You don't always know the best. So you always need some people that can change your mindset. So this person, I must say, he didn't get me any role. Like, it's not like he referred me somewhere or what. We just had that conversation, talked about what are the possible. He kept track of me to, once in a while, checked in to see, how are you doing? Are you, making those moves you said you will make? When I finally started my public specialist route, I wrote a very long epistle, a message to say to him,
Yeah.
thank you so much for you. And he was like, what did I do? I didn't do anything. But to me, just having somebody that is like an accountability mentor. So
Yeah.
you must realize that people will have different functions in your life. This person was just an accountability mentor, just to keep me accountable to the decisions and promises that I claimed I would do. Do you understand? So
Mhm.
that's I think a good example of what networking can do. But I think the problem is that many of our colleagues and many of our people from Nigeria, when you hear networking, you think connections and you think, oh, that person must get me a job where they are working. Many times, I'm sorry, but many times your connections cannot connect you to anywhere. All they
Anything.
can do is they will have a particular thing or particular advantage that they will bring to your life. I think it's wisdom to know who is in your life for what and utilize them for that. Like, you don't ask more of them. Don't pester people and why are you not giving me a job, but you are working in NHS in you don't actually know. Stop laughing. I'm telling you. So, but really, that's just it. That's just it for me.
Hmm. So, what message would you sort of like to share with doctors or clinicians who sort of feel stuck, especially those who feel their MPH hasn't opened any doors for them yet? Because I know there are a lot of them like that out there.
Yes, there are a lot, and I still have a lot of classmates who are in that same shoe and are shocked that I'm doing something public health, and all that.
Mhm.
I will tell you, number one, nobody has two heads. There's nothing special about me because I'm a public health specialist. Leave the role. There's special inside it, but there's nothing special about me. That's the first message, because I think people's mental health and well-being needs to be protected, because a lot of things happen. I've read so many things. I've seen people go into depression just because they think there's something wrong with them because they are not
Yeah.
getting the same results that people are getting. Now, that's one, and that's out of the way. My second message to people like that is that keep on trying. Do not give up. I can see, I wish I could print out all the unfortunatelies I have. One thing I've learned very quickly, and I think that will be my third message, is that where you will be, as in where people will like you, is where people will like you. Where people will not like you is where people will like. You can be one man's food is another man's poison. And that's the truth. I remember interviewing in multiple places within the space of 2 weeks and having different vibes from different people. So in one place, somebody actually, a consultant called me after the interview and told me that I totally missed it. Have you ever heard that in an
Wow.
interview? Said to me, I totally missed it. That, I was very good. I was eloquent. I was confident. I was this and that. But there was something they were looking for, and I did not deliver that to them. Now, this is one role. And guess what? This role was even a much lower role than in another role that I went to. And they were like, oh my God, we love your experience. So where you will be liked, you will be liked. Don't force it. You can only prepare as much as you can, but don't give up because, people in place A have said to you, maybe you don't know what you're doing or whatever, or they've given you a negative feedback. Don't
Yeah.
give up. Don't actually give up. And I'm saying this very clearly because there are so many, everybody who is in a role right now that you think is an important role or is doing well or whatever, have had a track record of unfortunately of disappointment of I can tell you this now for a fact. I done an interview to the stage where I got the job offer. They rescinded the job offer after giving me the job offer. I'm not kidding you. For one thing or the other, sometimes it could be sponsorship, sometimes it's something else. So, truthfully, do not think that there's something wrong with you or whatever. Just keep at it. The job where you will be hailed or treasured like a lost diamond is coming. Trust me on that. The job where they will actually appreciate you is coming.
It's
Just
coming.
keep on and keep at it. That's the truth. And another thing, I think the last thing I would say, because I talk too much, the last thing I would say is really don't be afraid to go back and rework and re-strategize, right? And we all get into that trap of thinking we know best. We know best. The intelligence we have is very good. Nobody can tell us anything. If you keep doing something one way, go back and ask yourself, okay, what can I change? What is
Yeah.
different? What other difference can I make? What else can I modify and change my strategy? It's only a fool that will keep doing something the same exact way and not and think that is normal. You keep getting the exact same results because of the same things that you're doing. No, don't be afraid to go back and think about how else you can do something and how else you can modify things. So I think that's it for me in a nutshell.
So if you're watching, you've heard it. So just hang in there, and it just takes 1 year. So that's what the I think that's a popular
Exactly.
saying. Yeah, it just takes 1 year to
It
change the
does.
whole story and all of that. So as we begin to wrap up, looking back at your whole journey, what's the biggest lesson you sort of learned that you probably want others to hear?
I say the biggest lesson I've learned so far is in the corporate workspace, nobody can advocate for you more than yourself.
Mm.
So, and I say this because I've seen it happen over and over, especially to many of our people who are from African background, where you think that when you come to a meeting of people that are maybe your seniors, both in role and in age or whatever, you think, oh no, I can't talk. I can't say anything here. Being quiet is the quickest way to kill your reputation in any company, in any organization. Being quiet, just be, oh no, you think that being quiet, oh, and the quiet girl over there means that you're calm and collected. There's nothing like that. There's no promotion that comes with being calm and collected. You need to voice out. As much as people around you, even if they are nice to you and all of that, they will not advocate for you more than they advocate for themselves. Nobody knows your impact and your importance more than yourself. You must speak up and you must be able to fight. You see, what happens in many organizations is that people get promoted because of what they are saying, not what they are doing. That's why you will come to an organization, somebody is working like Jackie, doing all the work, doing everything, but they don't gain that visibility with senior leaders and they don't gain that visibility where it matters and they don't get promoted. Or they are the easiest people that they will give redundancy, even people that are working much more than the senior leaders. But it is visibility. It is being able to speak up for yourself. It's being able to say, oh, do you know the projects that we're doing? Do you know this and that? And that is what has really helped me all through my career till now. And a very clear example of when that has helped me. I was talking to somebody randomly in my work and saying, oh, this is what we've done. We've done this for, some of the vulnerable population groups in Swindon. We've done this, we've done that. We've produced. It was a very informal meeting. I met somebody somewhere at a conference. And from that talk right now that we're on, somehow we got to publish an article on BBC. The
Wow.
BBC came to do a video coverage twice, 2 times now. They've done a video coverage in Swindon. I can share the links with you. We see my face
Please do.
smiling like this.
Wow.
No, I'm telling you, literally, they came to Swindon, they did some of the, and they shared some of our work on BBC Points West and on radio and all of that. And I've even been invited to radio stations to speak. So I'm telling you, this is from being able to just talk. So I find our people many times just keeping quiet, quiet, quiet. Oh, I'm calm and collected. Oh no, I don't want them to think that I'm arrogant. Please speak up for yourself, because many times you see empty vessels talking the loudest and getting all the promotions. So please, that's my
This,
message.
this thing you just told me, somebody told me a few weeks ago that I think one guy was promoted in the workplace. And and he was now questioning why was this guy promoted, because he knows there are a lot of people that work harder than this guy and deliver
Exactly.
much more results. But the guy, apparently, he's everywhere. He speaks up a lot.
Is
All the
it?
meetings, he's.
Is see, there are people that's that and my desire, my passion really is that we get more people who actually know the work in all those right positions of power,
Mhm.
who are, who have, as in, we get more people merit based to get into positions of power, and not just based on their talk and how they are and how they can, talk to people and all that. I find it everywhere, and I'm telling you this, everywhere what I've seen it happen. The person who is visible everywhere, talking to the DPH, talking to this person, talking to that, even though
Those
they
are
are
the
doing
people.
nothing. And I'm telling you, completely nothing. They're only probably supervising one thing. You have 10 projects under you. You are not talking up about one. Nobody will advocate for you, my dear.
Mhm. Good point there. Right. So as we wrap up today's conversation, I really want to extend a big thank you to you, Dr. Amblessed Ijoma, for sharing your journey with us, really. Your transition from clinical dentistry into public health, sharing all the challenges, how you overcame them, getting the job, and the lots of invaluable advice for a lot of us who are navigating their own path. I mean, this conversation has been really illuminating. And again, I think your story is a testament to resilience, adaptability, the power of strategic thinking in career progression, which I believe a lot of us actually need. So, for those watching, if you're a doctor who is currently facing this uncertainty of transitioning into public health, just remember, like she said, there's a way forward, and the insights she has shared during this conversation has clearly just shown that. So, for those watching, if you found value in this conversation, like the video, share with other people, tell us in the comment section what kind of topics do you want us to cover next. And until next time, keep pushing forward, keep learning, and I'll see you in the next episode. So, bye for now.